whether or not.
That is not fair.
I am just kidding. All right, ladies and gentlemen, welcome to the highly trained, wildly unfiltered healthcare podcast, your no BS podcast to healthcare. I am your host, Dr. Pete. To my left, maybe your right, is Keri Moran, physical therapist and clinical genius. Are you still uncomfortable with that?
Yep.
Are you ever going to not be uncomfortable with that?
Nope.
Moving on. You guys will know her by now. Third in the series with none other than Dr. Kim Delmage.
Hello,
That's
everybody.
to my right, but it might be to your left, depending on how you're looking at
It
it.
might be under the table if I can't get up on the stage.
That is very, very true. She's having some stool issues.
Ooh, that's a different topic.
That will be on our next No BS healthcare topic over here. Welcome back, Dr. Kim Delmage.
Thank you.
You
very
have
much.
been doing fantastic. The first two segments were incredibly informative, and I'm just absolutely loving this. You're doing, by the way,
I agree.
come on. Why are you so, you're
I
so
don't like
freaking
that.
good at this, though?
Like what? Just talking. I like talking to Kim.
I like talking to Keri.
So we talk to each other, just
We don't
pretend
know
like the
about you,
cameras,
but
the microphones, and the lights don't exist. We're
We're going to
fine.
pick you out. I think it's just going to be Keri and I.
You know what?
I don't know.
Did we not just have this discussion? Like I
Here's
could
the
do
wildly
nothing.
unfiltered part. You're fired.
Not the first time I've heard those words. So, all right. So we have done prenatal.
We have.
We have in the pregnancy, and we talked about the stress, and then we have now given birth, and we've talked about postnatal, and we have talked about these little newborns, and then they turned into waddlers,
Waddlers.
which is your term for the toddlers.
Yeah.
But now we are moving on.
Now we're moving on. We have entered the preschool through school age set.
Right, and we also have a bonus segment for you guys on this one, considering it's probably going to be Dr. Kim's last for a little bit right now, but there will be a bonus segment of very important stuff because I actually just watched it this morning, her do this very special technique and work that she does. I don't know if you call it a technique. It's not, but I'm going to give it as a little teaser.
Yep.
I'm not even going to mention what it is. So let's go ahead and move on to our preteens over here or whatever it is that
We've entered the school age time where we have kids have a mind of their own. No more, well, I mean, from the time they can throw a temper tantrum, they really can express the mind of their own.
Didn't mind throw a temper tantrum at like week 3 though. I mean,
Pretty sure Emma
Yeah.
did. Yeah, definitely.
give me the age group. What are we?
So
what are
we're
we talking
about usually age 3 or 4 till preteen. So
Got it.
we'll go around 12 years old.
Mm-hmm.
And this is the age group where they're in school now. They're starting to have more academic demands. And we've seen a lot happening as far as, and I've talked to a lot of teachers and people who work in the schools, we're expecting a lot more from kids from a younger age.
Absolutely.
So the thing that I've heard them say is, kindergarten is the new first grade, things of that nature. We're expecting 5-year-olds.
Is that like 50 is the new 40, Kara?
I don't know yet, Pete. I'm not 50
Yeah,
yet.
don't do that to her.
Not
I
yet.
was just asking.
She's really going to be fired.
I was just
I'm
asking.
hoping by the time I hit 50, 50 is the new 30.
That's it.
That's what Botox is for.
So we're now expecting little 5- and 6-year-olds to sit in a desk all day for 5-6 hours of the day.
Yeah.
Maybe a break for lunch, maybe a break for gym, but they're expected to sit in a chair all day and pay attention to a teacher at the front of the room who's not always teaching them something that they want to learn. It's not colors. When we're all old enough here to say, when we started kindergarten, if you didn't pee your pants,
Yep.
and
You graduated. That was it. That was the only criteria. Don't pee your pants by the end of
Don't pee your
it.
pants.
You can still poop your pants, but don't pee.
If you could tie your shoes and you knew your name and maybe your phone number,
I had
you were good to
kangaroos.
go.
So like
Velcro.
graduate magna
That was
cum
it.
laude
Like
with
you
that.
were the top of your
It's
class.
like-
You're valedictorian.
Holy cow.
Now,
And even going into kindergarten, like you didn't have to
Right?
have criteria to know. Like you,
No,
you knew your
absolutely.
name and maybe you knew some colors. Now
And-
it's like they have to know their name, their address, their phone number, their colors, their letters, their
they
numbers.
have to be able to count up to 100.
Yeah, it's crazy.
Yeah, for
didn't even know this.
preschool to be out of pre-K, they expect kids to be able to count to 100, even if it's by tens. And
I think they also needed a degree in basic engineering.
I think so. I'm pretty sure that.
Yeah,
also,
I mean, obviously, with the working moms. I was born in 1976. My mom
We were
stayed
all
home.
born in the 1900s. Might be a little difficult.
My
Some people
mom
don't
stayed
know.
home, and I didn't go to preschool. Now, I mean, there are very few kids that, don't
That
go to
don't go
preschool
to
at such a
preschool.
young age. So they
Exactly.
are being trained academically at a much younger age than we
Yes,
were.
absolutely.
And
There's
to be
different-
sitting and structured
They
days.
are. They are getting more of that structure. Unfortunately, we also have a lot of kids who they're maybe not able to sit through that structure. And it starts to become apparent the more they are expected to do these things. And some kids just literally cannot sit still and they cannot pay attention. And this is where we start to see they might pass through and get passed on through grades for a little bit. Usually by around the 3rd to 4th grade is when it really starts to show academically.
Yeah.
And you start to get the letters home saying they might need some basic services and maybe basic skills help. And parents are starting to say, well, I don't know how to help them.
Mm-hmm.
And whether they either were tested at school, they might qualify for help in school. A lot of kids fall right on that border where they need extra help, but they don't qualify for services at school.
Been there.
That's where we come in and can help them here.
Yeah.
We help parents kind of also understand why their kids are struggling. I had this conversation with a mom the other day where there's a part of our brain that is in charge of filtering out the unnecessary information around us. If you're sitting in that chair, Dr. Pete, now Dr. Pete probably doesn't have this filter.
I have zero
He has no
filter.
filters.
I think it was
Not
you who
have the
came up with the
filter.
wildly unfiltered. It was actually,
Yeah.
to be all honest, I would just in
It's
transparency because I am. It was actually supposed to be wildly inappropriate. We were advised against that.
Yeah.
So, second,
Because that is, Pete, wildly inappropriate. Yeah.
I didn't know you can't walk around naked in your office every once in a while. My apologies, but anyway, go ahead. You were gonna say
Anyway,
the
so
filter.
we're sitting here right now, and each of us are in a chair. Took me time to get into this chair. They get a kick out of watching it.
We actually should
Really
make
short.
this our next podcast.
No, I think
Absolutely not.
we could probably still get it on the way out. Let's see what happens over here.
Okay, so there are nerves in our butt, in the back of our legs, all over our body that are my butt nerves are saying, I'm sitting in a chair, sitting in a chair. I can't pay attention to that. I got to pay attention to you. I don't know, you got all those things coming in all the time.
I'm really trying to hold back. But my
I know,
going,
right?
butt chair.
Right, it's true. Right, you hear a ticking clock.
Right.
You see a squirrel run by the window. These kids cannot focus on what we're asking them to focus on because they can't filter out all that stuff.
So they become like
They
overstimulated.
become overstimulated. These are the kids who shut down. They can't stand the bright lights. They can't stand the loud noises. You'll see them just like go off the handle because their body's just been like to a rock concert where you're stimulated by everything around you and you just need 5 minutes to yourself.
Yeah.
And if we're not giving them that skill to teach them how to handle that, they just are going to shut down, and you'll have kids who are avoiding going to school. You're having kids who they won't put on their shoes because there's a wrinkle in their sock.
Yeah.
Their body is so overstimulated by all these.
I can't even believe you're
Sensitive
prompting my memory of, we were doing some, diplomate and neurology stuff and everything like that. And literally the section of your brain stem, most of the stuff that goes on in the brain stem is the diffuser, that you're developing a diffuser because your brain is constantly pushing out a billion things. And you need like the thalamus and some of the brain stem to calm it down. So they're inhibitory pathways that are held. So what you're saying now, I'm putting what you're saying, like in the
absolutely.
world,
Yeah.
to the neurology. Like they haven't developed the thalamus, they haven't developed the brainstem to help diffuse that stuff. It makes so much sense. Dr. Kim!
I know the fancy technical words.
Jeez.
Reticular formation.
There it is, the RF, ladies and gentlemen.
And that is the job of that reticular formation, to filter out the unnecessary. So, Keri, I can see that you have a bright light behind your head, but I can focus on your eyes because
can't.
You can filter it
and
out.
he cannot.
All
he
I can
cannot.
see right now is butt chair, butt chair, butt chair, butt chair.
This is our day every day.
And how do you also try to wave out, because I'm sure teachers and parents get frustrated with these
Yes.
students because they don't understand what is an actual behavioral issue versus what is like an issue with their
Exactly.
ability to understand their environment and process.
Exactly. And it can be really hard to decipher. I mean, I
Yeah.
have parents who are bringing their kids in and they're just like, they're getting disciplined at school. I'm giving them timeouts. Nothing works. And unfortunately for some of these kids, if you can't figure out the difference between the behavioral and
physiology,
what they cannot control, you're punishing a kid for something that they absolutely
really
don't have
can't
control
control.
over.
Yeah.
And
I might cry by the end of this one because I think I'm that parent that just,
it can
help
be
me.
really frustrating as a parent because you're being told, like, unfortunately, all the comparison between other kids. A teacher's got 30 kids in a classroom. It can be extremely hard for a teacher to say, I can't give this kid what they need at all times. So we need to be able to come in and give them those tools on how to do that. And we do that with things like kids will come in here and I have them sitting on a vibrating pad so that we turn up the volume on those butt nerves so that it becomes more like static.
Right.
So it becomes white noise to those nerves. And it helps them to say, okay, I feel those, but I can tune that out because now they're so stimulated
Right.
that I know
So then when they go to sit in a basic chair,
that eventually will
The
learn.
body's like, oh,
yeah.
okay.
Yeah.
Yep,
It's very
absolutely.
I actually have this conversation with our patients almost every single day. When you put on your shirt in the morning, let's talk about an adult who may or may not be able to understand what we're
Yeah.
talking about in a preteen, going down to
Yeah.
a child like that. You put on your shirt in the morning and you feel yourself put on the shirt. And you probably feel the shirt maybe for about another minute or so. And then guess what? You don't really feel the shirt on your body anymore. Until
I'm just trying to feel if I feel my shirt.
Well, now you can feel because I had to. But until maybe the wind blows, right, and then it hits your shirt or something hits your shirt, right? And what happens is your body has a certain threshold, right? And then you put your shirt on, it's like, ooh, it's hitting that threshold constantly, shirt. And the body realizes, all right, I don't need to constantly have this one because it's not dangerous, it's not going to do anything. So now the threshold comes up over here. And so your shirt is here, it's not hitting that threshold, but then the wind blows, whoop, hits the threshold. Well, I feel the shirt, and then it comes back down. This is what you're
And
saying.
then you advance that to somebody who, like, a tag. They have to rip out every tag.
Every tag,
The tag,
every
no matter what.
seam,
This is like a
every-
sensory thing.
Yeah.
The tag, or even like
Yes.
one of our old co-workers, she had to turn her socks inside out
Yes.
because
The
the
seam.
seam of
Seams
the
in the
sock on
sock.
the inside irritated her so much that she could not put her foot in a shoe. Like, so
Yep.
those things to me.
That was from a movie. You remember that with
crazy.
Sean Connery? It
Yeah.
was He Got Game or something like that. And the guy was like, "Why are you turning your socks inside out?" He goes, "I don't understand why they put the seams on the inside.
Yeah.
Like, they should put the seams on the
And
outside."
for 99% of us, that's very hard to
And
understand
exactly.
why. How
If
could
you-
somebody even feel that?
And if you
know?
don't have that low threshold where you are overstimulated,
Yeah.
and for a lot of parents, they cannot relate to what their
They
child
can't
is
relate to their
experiencing.
child.
All right, so blowing T-shirt in the wind. There you go, just
Yes.
T-shirt.
Yep.
Yeah.
Nice.
I
Amazing.
equate it also, if you ever walked in a room, the kitchen garbage smells, you're in there for 5 minutes, someone else walks in, oh, can't you smell that? Oh, I did
Nose
at
blind.
first, but I don't
Yeah.
smell it
Nose
anymore.
blind. That's a good
Because
analogy, yeah.
I said, your nerves have been stimulated by that enough, and they blocked it out, saying, nope, that's not important for me to smell right now.
Yeah.
So that's how we teach kids to filter out the extra noises
I was thinking
around.
something, but I'm not going to say it.
It's unfiltered.
All right, well,
It's unfiltered.
Keri needs to be dumb blind so that the dumb doesn't bother her anymore.
Oh, I
Oh,
do. I do. I am prejudiced against that. I really am. Actually, no. It's not even dumb blind. It's lazy blind.
sense?
Okay.
I think it's lazy blind.
Yeah.
I can actually understand and sympathize for people that don't have the intellect or
Right,
like
that's fine.
like
You're 100%.
children who
That's
don't
not a
have the
choice.
processing,
Yeah.
right? So for me, it's like,
Exactly.
what is
They
a
can't
processing
process it.
issue versus
Yeah.
a brat, right? Like, if
Yeah.
we're gonna be unfiltered.
Yeah.
Choice versus
Same
not
thing for
choice.
me.
Yeah,
Like,
yeah.
what is like
Absolutely.
somebody who's just has the tools and doesn't use them and they're lazy? That's where I lose.
I can relate 100% to that.
is
All right.
I lose my
very-
tolerance.
that-
There we go. Whatever blind we need to be, we need to get
Exactly.
this one over there. We'll get her some earmuffs. All right,
my
sorry,
goodness.
I completely distracted you.
That's okay.
We'll move back on. But
so one of the things that we talk about with parents is that this is a multifaceted approach. Okay, with all of the things that we do here in this office, it's one of the things I love most is that we work with other providers because I don't know it all, you don't know it all. We like to pretend sometimes we do, but we don't. So I may have a child who needs additional help with cognitive behavioral therapy. They're going to work with their therapist, and I'm going to communicate with them. And then we're going to have an occupational therapist if they need help with certain strengthening. And we form a team approach because no one thing is going to fix all of the things that these kids need.
Yeah.
So just saying, well, they go to speech therapy or they go to OT.
Yeah.
Well, unfortunately, most of these kids need a multifaceted
Well,
approach.
and the other
because there's
approach
so
too
much
is that
happening.
back in my day when I first started out of college, I did pediatric therapy
Yeah.
in the schools, and kids were referred to our resources for care, and if they were referred to PT, I was doing an evaluation within the week. Starting care if necessary, and the guidelines for care were lower back then. Like, so
Yes.
it was easier to attain care for these
Yeah.
kids. The guidelines have been raised. The bar has been raised for what would require your kid to get in school setting therapies for PT, OT, speech, stuff like that.
Right.
And the timeline for these evaluations are pushed not only weeks, but months. So there are
Months.
kids that are waiting
Yeah.
almost a full academic year for an OT evaluation because they
Absolutely.
are so overwhelmed with kids that are needing these services.
Yep.
So some of the
And that's
things that-
even with the higher threshold that you need to meet too.
And so
So
some of these kids, while they're just waiting, are
Yeah.
5, 6, 7 months in that school year, and that school year can often be a loss to them. Then. You know what I
absolutely.
mean? Because they're, like you said, so overstimulated that
Yes.
nothing's processing. And
Butt
every
chair,
month
butt
that
chair,
keeps
butt chair,
going,
butt chair.
I would assume the frustration just builds and
Just
their
builds and
desire
builds
to
and
go to
builds.
school or be a part of school just continues to fall
Exactly.
through.
And then when they have that trigger, so for example, a kid with visual tracking issues because their neck muscles on one side were really tight and now they're getting more stimulation over here, so they have maybe a lazy eye or they have something going on where they can't process this information. They're looking at it, they can't process it. They've got butt chair happening. And these poor kids, why would you want to go in that environment?
Yeah.
Right.
They're going to fight you. They're going to see that homework. They're going to throw tantrums at home. You're going to have fights every night about the homework they're expected to do. And both sides, kids, parents, teachers, everybody are frustrated to the point of they throw up their hands and say, I just don't know what to do anymore.
And they're being tested on that A to Z, the reading logs. Like, so like,
Right.
where do you
Yes.
start? And these kids at very young ages. I remember my twins being in first grade, coming home, like, I got my reading test today, and one knew that they were reading higher because their letter was higher. And it was
Yeah.
like
Right.
a bragging right in our house.
Yeah.
Right.
"No."
I'm at an
Everybody
F.
reads at their
Yeah.
own
Yeah.
pace. We all end
Exactly.
up at the same letter by a certain time in sixth grade, But these kids are also being devalued internally by themselves
Right.
at a very young
Absolutely.
age because they're noticing and recognizing the differences in
the
themselves.
labeling occurs right off the bat right now. It's not necessarily a positive thing. I'm not
No.
a huge fan of the labels, and it's like you have to get labeled in order to be able to get the extra help.
Yeah.
It's just like a little bit of a catch-22. I'm not
That's
in
why I
love
like
with it.
to give kids attainable goals.
Yep.
Yeah.
Even if they're small, because
Doesn't matter.
once they feel proud of themselves for reaching that, they're like, okay, now I'm willing to try something else because
Yep.
I did that.
Momentum.
I could do that.
Yeah.
Yeah.
So you were playing, Kim. So like one of the
Yeah.
topics that Dr. Pete was talking about is sensory integration.
Bonus
So
segment,
this is-
ladies and gentlemen.
Yes.
So this
Sensory.
is. I will tell you, Kim has now had
Oh.
a patient who is traveling over an hour to bring her son to
I
see
have the
her.
goosebumps about the story you guys are about to hear.
Yeah.
Because it's
Yeah.
unreal.
And this is somebody who called all over her area where she is from
Mm-hmm.
and was almost kind of scoffed or laughed at as like a chiropractor that deals with sensory
Yes.
integration.
Yes, was
Right?
told that's not a thing.
Yeah.
No, I don't know anybody who does that.
Yeah.
And this poor woman was just so disheartened and called our office and got to speak with someone who just said, yes, of course we can do that.
Yeah.
And it makes me frustrated that there aren't more resources out there. So coming soon, Pete will be happy. I'm going to announce it here live, Pete. Are you ready?
Oh boy.
Right here,
Yeah.
right now,
Yep.
on the bonus segment,
The bonus segment.
As long as you're paying for it.
I might turn the microphones off, the cameras off.
Now, Dr. Pete loves to get me out of my comfort zone.
Sure do.
This especially. He got me playing golf last week.
Yes. Yes,
Mm-hmm.
we did. We did. It was
Dr. Pete, I would like to do my own podcast.
Oh.
You thought I was going to get nervous about that?
No, I think you're going to be so excited about it.
I absolutely was the greatest thing I've ever
I would
heard.
love to do something where we can get parents to come in and kids and talk about the challenges that they're facing and how we can best help them.
I'll even put a ladder to get up to the chair if you want. Are you kidding me?
Yay!
I love that idea. That's a
Kim!
great idea.
Just launched our own podcast. Do we have a name? Do we have anything?
We do not have a name. I mean, the other stuff that I talk to my patients about, which not for kids, but since we're unfiltered, is the shit no one talks about.
Exactly.
I mean, that's what I talk about with my patients when they're here for pregnancy and they tell me a complaint and I say, well, this is the stuff that nobody talks about.
Yeah, when they're pregnant.
Right.
Everything's beautiful. It's wonderful.
So, yes.
No.
Birth is beautiful.
Obviously, I mean, you're coming into
yeah.
our office and we are seeing what people are going through during their pregnancy. So
Absolutely.
obviously, but
So,
I'm so different than everybody else because I lay it out there and I understand why people don't. I get it. And for me, it's like, I need your help. My people, I need your help to go through what I'm going through right now.
Yeah.
So it's, that's my philosophy. So I love that you,
I think
can we
time-
possibly call it the shit that no one talks about?
I don't know. It's for kids. It's
Then maybe
not.
the ish. No. Well, we'll figure it out.
We'll figure it out.
Nobody
You know what, guys?
I mean,
Help us
if you-
out.
yeah,
We'll
help us
take
out with
it.
it.
Yeah, come on.
But yeah, I would love, because parents and kids are really lacking the resources, and what better resource than other people who are going through what you're going through?
Absolutely.
Tell us what works for
agree.
you, what doesn't work for you, what you've tried. I have my own mommy network, but
I mean,
can
a lot
only
of
make
people
it
just
stronger by
picking up their kids from home and dropping them off to preschool or school before they go to work would be able to
Absolutely.
get 10 to 20 minutes of something that might really help them get
Exactly.
through their
Super
day.
unbelievably valuable information that obviously not everybody wants to talk about in front of everybody, but if they can hear
Yeah.
it in the confines of their own car, their office, or something
When-
like that.
when I get together with moms who have a similar issue with their kids and they can go back and forth, the ideas and the amazing things that come out of some of these.
Now I'm going to cry for this reason, Kim.
Yeah.
Here I thought I was just a bad parent.
This week,
No,
like,
I-
what is going on?
No.
I guess I'm the twat waffle.
Like,
right
you
now,
are the
so.
twat waffle
That's
today.
it. I am the twat waffle today. Hey, listen, I acknowledge that every once in a while I must. I don't know. I mean, it's been gray out. I don't know what to tell you. Kim,
No. Yes, sir.
I'm unbelievably proud. I cannot wait for you to launch this first one. When is it going to be?
Oh, well.
I'm putting you on the spot.
Okay, let's figure out when this room is open and when you can get me a
Now.
step stool.
It's now.
Right
It's
When
not. We have a
this is
podcast after
opening.
this, though, but
Maybe it'll be part of my
This
Saturday.
is
There
for
we go.
somebody, by the way, folks. We were just talking about Kim, who has been here for over 10 years
Yeah.
and has patiently grown her prenatal, postnatal, and pediatric practice. Because, in order to have a 40-hour job, you can't just say, well, I'm only going to treat the patients I want to treat. And she loves treating orthopedic and, kind of regular
Yes.
chiropractic patients.
Family practice.
But her
Yeah.
integration has taken 10 years to really
has.
kind of build
It
where it's
really
like a
has,
50-50
yeah.
practice. And we always say, we always laugh, there's always pregnant women here and babies. And
Yeah.
she gets the cutest patients. All of the cute ones always go right back
Oh,
into
thank
Kim's
you,
family
Kara.
room.
Aw. Appreciate it.
I mean, I've been
She treats
hugged
me.
and kissed and arms wrapped around me today, and not just by Pete.
Yeah.
a couple of times. So, no,
I'm really
I mean,
proud of you for continuing to follow your dreams
Absolutely.
and goals, but realistically understanding what it takes to get there,
and the results that you are getting
Yes.
are I want to be able to express this to the world. I'm not a pre and postnatal kind of person. Like you said, I treat patients, I treat babies,
Yeah.
I treat pregnant women. I typically know a lot more about sports. So watching you do what you do and the results that you are getting with these kids is like, how is that even possible?
'Cause
So
you
I
do
mean,
it with
how do we?
passion.
Yeah.
That's why.
It's amazing. That one baby, like you were holding, was it yesterday? I don't even know. The days melted together
Oh,
because
yeah.
like every
Oh.
single
Yeah, there were a
baby
lot of
that
babies
comes
here this
in,
week.
every single baby that comes in here, you're just seeing the progress happens so much quicker in kids. I think it's just like you just see it through the course of a week. It's
So true.
amazing. So,
Yeah.
Dr. Kim, I mean,
Yes.
unbelievable. I'm sure there's more to talk about.
I'm
I'm
sure
just
there is.
so.
Well, now she can do it on her own podcast.
Well,
Hey-o. Fantastic. I'm so proud of you in so many ways. By the way,
except my golfing skills. So those are
you picked up a real golf club for the first time ever.
Way too
Taller
tall
than me.
for
Yeah, hold on.
Sally's golf
It was.
club.
As you said, you are the putt queen, but you took a real golf club, and
I
by
did.
that last hole, you hit
did.
a golf ball from the tee to the middle of the fairway.
You did.
Yeah.
All right, that's your first time ever in a
In a skirt. In a skirt. Yep.
In a skirt, amongst her peers that she had to go around, right? I mean, this wasn't just a bunch of
True.
strangers out
True.
there. So, amazing. Is there anything else that we need to cover right now? Because I don't want to miss anything on the
I know one of
Dr.
the things
Kim
that
segments
Kim has
over
been
here.
doing really is integrating into school systems and stuff too, like
Yes.
your sensory
Right.
program in preschools.
I love it
and I'm
when we
sure
can do
that'll be
that.
something that you can go into further when you do your own
Yeah.
podcast and explain to different audiences, how you are available to do that too, not only just as a one-on-one service, but to schools and helping not only the kids in the classrooms, but the aides and the teachers figure out what best ways to integrate that into every class, because every kid could use it nowadays. Every kid is overstimulated with the iPads, the phones,
I have
16 things going on.
Exactly. Never met someone who doesn't need a little extra help now and then.
100%. 100%.
Yeah, and we never had this. Us born in the 1900s. What was our stimulus? You know, I mean, when we were growing up, going through kindergarten, what was our stimulus? I don't even think Atari was out at that point.
I had to get up to change the TV. Like, I had to turn my grandmother's TV to the right to change a channel. These kids have TV on with something scrolling on the bottom, their phone's going off.
It was that comedian. Like, how many screens could you have in between your TV and your eyes? How many screens could it possibly be? So you have the TV, then you have the computer, then you have your phone, then you have your Apple Watch, then you have your Oura Ring, then you have, like, how many things could you possibly, like...
And things that are buzzing and binging, and it's very overwhelming.
We have the construction over here, too. Yeah. But we also had channel 2, 4, 5, 7, 9, 11, and 13.
Yeah.
And nobody was watching some of those channels too, right? So, I mean, that was it. So everything, I mean, this is not just even talking about children. Our adults, we are having issues as a result of overstimulation. Yeah. And, I mean, obviously, we can get there as we go up into teenagers, and it's got to be so tough for them right now. And just helping people not feel like they're being bad parents or being bad teachers, because it's not a behavioral thing. It is a physiological thing. And having an expert being able to tell you, this is how you identify that. Yeah. Right? This is how you identify it. And so being able to, don't get me wrong, there's some pretty terrible kids out there, little spoiled brats. That's going to be a whole different situation. That's a different, but we're talking about specific neurosensory issues and everything like that. And I only think it's going to get worse because of the constant stimulus. So there's going to be even more of a need for the stuff that you are currently doing, and you are doing it very well. So please bring it to the world.
Okay.
And I'm super excited about that. That was it. That's all I have to say about that.
Thank you, Kim.
Well, thank you guys for having me.
Chair. That's going to be our new theme song. Dr. Kim, segment 3, you killed it. Absolutely amazing. And I cannot wait.
I was trying to get out of this. How did I get roped into doing my own? What am I thinking?
You know who's roped in, by the way? You know who's roped in?
Spin.
This girl right over here, ladies and gentlemen. Clinical genius, and now...
You keep saying that word. I'm abandoning the job.
Co-host. Keri, you're amazing.
Just more time with Peter. More time. So nice.
Maybe that's why I'm at my own.
Nope. Yeah, right. No Pete.
No Pete.
You guys don't have butt chair.
Pete is definitely a natural.
Guys, this has been great. Thank you so much again for joining us. Bye. Highly trained, wildly unfiltered healthcare podcast. Your no BS information source for healthcare. We say bad words here sometimes, but we will try to limit. Just sometimes. Maybe we can bleep them out and like PG rated some of it over there. But until next time, guys, have a wonderful time.
Thank you, guys.
Bye. Everybody.